Hi, this is Betsy Altman, and I am going to be talking about wireless network design for the course ITT 370 for Professor Bass. First of all, the design that I needed to create was for the hospital case study. The case study included building a new wireless network. The current network was a few years old, and so because it was built using proprietary standards, not the 802.11, then we were not able to upgrade. Instead, it was needed to remove the old network to replace it with a new one. In the case study, the hospital was asking for a new wireless network that included handheld devices for the nurses, scannable wristbands for the patient. So when the nurses were able to scan the wristbands with their handheld devices, it would show information such as their name and age, surgeries, doctors, critical information that was easy to access. And then it also asked for the installation of new wireless IP phones for the doctors as they traveled around so that it would be easier to reach them while they were on the job. So first of all, we had to look at the scope of this project because the old network was using older standards. This one was to be built using the 802.11 protocol. The handheld devices would need to be able to access the electronic medical records or the EMR system. There was an EMR system put into place. However, it was only using networked workstations that were able to access the servers and the data stored on the servers. So using the EMR, the new EMR system, the nurses should be able to scan patients' barcodes to view the following: name, age, medications that they were on, the doctors that were seeing them, their diet, and any surgeries past or future that had been scheduled. And then the scope also included a wireless IP phone for each doctor. And in my research, I found that there should be approximately 5 practicing doctors in this size hospital. So the feasibility of this project, when looking at the research, I found that because the entire existing network would need to be removed, this would not only take time, but it would also take manpower and labor that would need to be accounted for. There would need to be a disbursement of the handheld devices once they were ready to the nurses. So the nurses would need to be trained on how to use the devices as well as how to care for the devices. So that again would take money and manpower to train them. The networked workstations, because they were old and on the old system, would need to be replaced with mobile laptops. And I also looked at the stakeholders affected, which included the patients, the doctors, the nurses, as well as any charitable supporters who would be supporting the hospital financially in this new network. I also looked at user authentication that needed to be put into place because the integrity of the data was at a high level for this hospital project. This network was going to include many needs, not only because it is a new wireless network, but because it is a hospital's network, it required more complex security and reliability than regular wireless networks that we might look at, because the reliability would possibly mean life or death situations. If a machine were to go out or lose wireless connection, then that could mean an issue with the patient. We did need multiple levels of data access for this network, and it needed to be able to hold at least 1,000 employees for the size of the hospital. Also, because of the number of patients that are coming in and out that are being seen on a regular basis, that are the doctors, the nurses, everyone who is accessing that network, the network for the hospital needed to have a very large throughput in order to accommodate for all of the people that would be using it. So here I've included my original network design. As you can see, there is a firewall in place as well as VPN tunnels, remote access for in-home care and the specialists that would be using that, as well as a tunnel for the handheld devices for the nurses to scan the barcodes. Each patient room in the ER as well as in the other areas would have a switch going out to them where there would be a workstation as well as a printer that would be networked. The pharmacy, the lab, and the radiology would also have a workstation and a printer, all of which connect to the server to get the data. And then the reception office would also have a server, or a switch, excuse me, wireless IP phones, and a printer. Quality of service was a very big thing for the hospital. So multiple servers would need to be put into place in order to hold the amount of data that was stored. All devices, especially the wireless IP phones and the handheld devices, needed to be configured with encryption. The system needed to be fault tolerant, and the network bandwidth needed to accommodate a growing number of users, because in the case study it talked about the growth of the hospital. The quality of service for all the applications that are to be used for all of the different pieces of equipment, including the monitors and the radiology equipment, all of that needed to be ensured for quality of service before they were deployed. As I stated before, the reliability and the security of the data that was, or the network for a hospital, is even more important than a regular wireless network. This is due to the HIPAA Act, which was the Health Insurance Portability and Accountability Act of 1996. This act safeguards medical information stored on a healthcare network. So for this reason, the hospital needed to make sure that their network was very secure so that there was no data breach, there was no information going into the wrong hands. Again, the reliability of the network could mean life or death. Also, there needed to be an intrusion detection system in place that would notify the IT administrators at an onset of a network breach. This way, the team could react as quickly as possible and there would not be any downtime in the network. To keep the network as safe as possible and secure, there would need to be segregated wireless channels as well as user authentication that would limit the amount of access that each user had. In addition to the patient data being stored on the network, the payment card industry, the PCI, also ensures that the insurance and payment information is kept secure. So when patients are paying with a credit card or phone or over the phone, that information is encrypted and secured as well. So this is a example of my network design showing the security measures that need to be put into place. You'll notice that every subnet has a VPN tunnel, as well as it's going through the firewall, and it has its own VPN router and access point so that there are subnets divided up. Also, you'll notice that there is a lock for the handheld devices as well as remote access, meaning that those users will also need to authenticate before using those devices. I also included a Cisco packet tracer design explaining another view of the network and how it will connect all of the devices together. When looking at the detailed design documentation for this project, These were the tangible items that needed to be purchased. You'll notice that there are the access points, the, the handheld devices, the IP phones, and I also included for the Ethernet cable, which would need to be included in the process. Here is a cost analysis of the tangible items. This does not include the labor for installing and uninstalling the old system as well as installing the new system, or the labor for training of the nurses and doctors and other employees and stakeholders on how to use the devices on the new network. However, you'll notice that the tangible cost do include all of those products mentioned before, as well as the price for each one and the quantity and the total price that each of those are going to cost. So of the over 200,000 that was quoted in the beginning of this project, 63,000 of that approximately will go toward tangible items.